tax credits to help them provide insurance to their employees. Companies with less than 10 employees will be able to get 35% tax credit, and companies ranging from 11 to 25 employees will also be eligible for partial credits. Some people cannot buy insurance because they have pre-existing conditions, meaning that they have a health problem, so insurers won't want to insure them. The healthcare bill will now prohibit insurers from denying coverage to people with pre-existing health conditions by 2014. During the 4-year gap from now until 2014, the bill sets up national short-term high-risk pools for individuals with pre-existing health conditions to buy insurance. Children are guaranteed insurance starting around September of this year. These provisions, the exchanges, subsidized insurance, and prohibiting exclusion will help to cover the millions of uninsured in our country. Many people argue, however, that the bill is expensive. It is expensive. It is expensive. $940 billion expensive. However, according to the Congressional Budget Office, which is nonpartisan, the bill will actually help to reduce the deficit by $143 billion in the next decade and a total of $1.2 trillion in the next 20 years. The bill will do so by imposing new taxes on the richest of our country, imposing fees on the healthcare industry, and establishing cuts in government health spending. Taxes will go to those individuals who make more than $200,000 a year. Also, any insurance company selling expensive healthcare insurance will be given a tax. This is known as the Cadillac tax. Also, the money that the bill will raise and the excesses that the bill will cut back on will help to reduce the deficit, even though the bill may cost a lot. The healthcare reform bill hopes to significantly overhaul the current system by getting more organized and more efficient. Our healthcare system has been run by private insurers who are looking to make a profit. The bill creates provisions for insurance company transparency and a more regulated marketplace. Companies must file for any premium price raises and offer legitimate evidence for higher risks. Also, companies will offer a standard minimum insurance so that no one is cheated. The bill will also provide financial incentives for doctors and hospitals to be more efficient and give more coordinated care. This means that doctors should try to get to know the patient and spend quality time diagnosing and treating them. It also means hospitals must keep better records. Other nations with a centralized, more streamlined healthcare system have been able to keep their costs to about 10% of their GNP. America's system has its costs at 18% of their GNP, and it's still on an exponential rise. However, with reform, we will be able to provide the millions in our country with insurance, cut back on costs, and create a more streamlined and efficient system. Thank you.
Good afternoon, honorary judges and fellow interns.
Hi, I'm Amy.
I'm William.
I'm Deborah Tang, and we will be arguing against the healthcare reform for today. As we all know, America is one of the few remaining nations that did not have universal healthcare, and as of March 23rd, 2010, America now does. But before we get into that, shouldn't we take a step and pause and consider what we have caused because of the reform? Our group thinks of three questions to ask. First, will it cost us some of our own personal freedom? Then, will it cost us financially as a nation in the form of more deficit and debt? And lastly, will it cost us more individually in the form of taxes? Unfortunately, after much deliberation and research, our group has decided that the answer to all of these questions is yes. So let's start from the first question, personal freedom. The Bill of Rights and the Constitution does not explicitly state that the government can handle such personal affairs such as making sure that you have your own coverage, if you're safe, if you can get the medical attention you need. The only thing it's stated exactly in the Constitution is that the government can help us promote welfare and help us pursue happiness. Other than this kind of loss of freedom, we also have loss of choices. For example, if you are young and healthy compared to somebody who has unhealthy habits such as smoking, you would be getting the same